All right, guys, let's go ahead and get started by going over what we've already covered. So we did the our notes page titled "The Skin," and we went over the structure of the skin. Okay, that then took us to our sensory receptors in the skin, which we went into. We did say that both of these were two separate diagrams, but these items are in the same space. Okay, so very, very tiny. Then we went into the healthy and unhealthy skin and how that happens with the normal follicle and sebaceous gland. What happens when we don't exfoliate, the pore closes, it begins to get inflamed, and then there's the very, very infected type of follicle situation that we have going on that could have been prevented should we had we followed the proper healthy procedures for our skin. Okay. And then after that, we went through and we talked about bad nutritional habits and then just bad habits of what affects our skin. And we also talked about the sugar face and what sugar does to our face. Okay, now we're only talking about the face because obviously we're working on facials, but this is the epidermis, so it's the entire skin, the whole of your whole body. Okay, so moving on from here, we're going to go to another factor that affects your skin transitioning from nice, baby, soft, smooth to our more aged, wrinkled, worn type of skin, which is age, right? That comes with age. So we're on page 14 and 15 of our notes. So on your from your cut and paste journal, go ahead and cut out. And again, I used tape instead of the glue on this one, but go ahead and glue down your page. And this is going to be talking about whenever you're aging, what are some of the things that are happening to the outside of your skin. And then we're going to go over what are some of the reasons why and going under the skin with our muscles and such. And then we're going to come over and talk about the collagen and the elastic fibers that we have and how that affects us from young skin to older skin. So let's go ahead and get started. We're going to start on this side here. So go ahead and grab your markers and your scissors and your glue. Go ahead and you can glue this down. You can pause here, and whenever you're ready, you can come back and join us. All right, so we are going to go ahead and come in here. Our title is going to be Under the Skin. Aged under the skin. So a lot of times people think, oh, if I buy this lotion, oh, if I buy this serum, oh, if I buy this scrub, this mask, this makeup, this etc., etc. If I buy all of this stuff and put it on the top of my face, on top of my skin, my face is going to look better because my skin is going to look better. No, that is not correct. It does have some truth to it. Yes, you use good products. Yes, you do help your skin tremendously, but no, the skin does not only get nourished from the outside, it gets nourished from the inside. And a lot of the things we can help by drinking a lot of water, staying hydrated so we don't have chapped lips, right? So they're nice and smooth and plump. We can get plenty of sleep so we don't have the bags under our eyes, the dark circles, and the droopy look to our eye area. There's those kinds of things that we can do, right? We can wash our face. We can do everything we can to avoid any of the inflamed follicles with the acne type of a situation, so that, we don't have scars that are there. Sometimes they're here, then they go, and then sometimes they kind of stay for a good long while, and sometimes it's just a scar that we have for the rest of forever. So those are some of the things that we can do to help avoid our skin aging. Some things we can't avoid. One of those is gravity. We live on Earth, and there's a thing called gravity, and no one is immune to gravity. So because you stand upright, the weight of your skin over time will weigh down your skin, and it will sag naturally. There's not much you can do about that, okay? Naturally that happens. That's why our skin droops downward, not sideways or upward, since gravity pulls it down, right? So cell regeneration does not happen as well as we age as when it did when we were younger. Things of the sort, okay? So we're going to go over that just a little bit. Now, we're not going to go over all of the terms that we have here. I just want to highlight a few things. So, for example, here on the outside, so if you just take your marker, and if you just go down the middle here, and you just split your guest down the middle, right? On this side of the diagram, this is on the outside. So what you see, right? And this side is underneath on the inside. And this is what you don't see, right? You don't see it. It's underneath the skin. It's not ever exposed unless if you have a wound, okay? So for this particular one, for example, on the forehead, when you get older, as you age, okay, you do see forehead creases, okay? And your forehead creases, there's two different directions. You'll have the horizontal ones, and some people have the vertical creases, okay? Those are from your frontalis. Okay, so again, the frontalis, remember, is the muscle on the front forehead. Okay, and the contraction of that muscle as your facial expressions continue to move throughout the span of your life. When you're lifting your eyebrows, when you're mad, when you're excited, when you're scared, when you're upset, when you're laughing, all the contractions that those muscles do over time, just like the wrinkles on our hands, they start to mark themselves just a little bit more each time. And so then you'll have those wrinkles, okay? Sure, you can put creams and serums and things of the sort, but it's not just what's happening on the outside, it's coming from underneath as well, okay? The next thing that we have, or just going down the line, temporal wasting. Okay, this little part here where it begins to dent in here at your temporal, okay, which is the side of your temple. This is the temporal fat pad atrophy. Okay, this part here, you're losing the fat that you have here. Just like you've noticed, as you age, or as you see people age, you see people get a little bit smaller, right, in size. And so a lot of the body fat is wasting away. And so that in the temple area, as you age, that fat pad goes away, starts diminishing. And so on the outside, on the inside, the fat pad's going away. Obviously, you can't see the fat pad on the outside, but that's going away. So it's starting to hollow out from the outside. That's what it looks like, a little hollow spot, okay? Whenever you are, for example, your crow's feet, these very common lines that you have here on the sides of your eyes, on the outside corners when you smile. Everybody has them very finely when we're younger, but as we age, they definitely are more visible. Okay, so we do have the lower lid laxity. So it does, and of course, you know, the orbicularis as it's moving around, we've gone over those muscles already, but as it opens and closes over time, the skin is moving here, the skin, the contractions of all the different muscle and those muscle groups, all of these things come together, make uh, they function together to make your eye open and close, and also to help with your facial expressions. But over the length of a lifetime, as you get older, they do create the wrinkles, okay? And so the ones by the eyes, we call them the crow's feet, okay? Because they're just long and thin like crow's foot, okay? So as you're looking at all of these here, for example, your cheek descent, okay? A lot of us, as we get older, we have our cheeks that start to thin out and start to droop. So here it is because we have a little bit of the, and it also comes from up here as well, but we have a little bit of the loss of the mid-face fat, okay, in this area. Okay, and then also we have the fat that is descending as well. So your cheeks are nice and higher up and plump, the apples of the cheeks there. And then as you get older, they start to sag. And so you'll start to see your cheeks kind of come down. That's why a lot of people get cheek implants. Okay, so that way they can plump up this cheek area and it lifts their face upwards. Now, if plastic surgery is something that you're into, something that you would like to offer or do as a career, that is something you can do. You just obviously would have to go into the medical field for that, but it is within the beauty industry, okay? In salons, they also have doctors, licensed doctors that come in and they work in the salon or like in med spas, and they do offer Botox, fillers. You know, there's so many different, and I'm not very up to date with the latest trends of facial reconstruction and things of the sort, facelifts and such. But there's so many different techniques that have evolved and have come about to do some kind of facelift without invasive type of surgery. Okay, so but if that is something that interests you, please do know that that is something that you can do within this industry. Not with your cosmetology license, but you have to have more education and definitely have your doctorates and all that good stuff. But there's you know, more to it, but just do know it is an avenue for you to explore if that is what you would like. Okay, so as you go down through here, there's tons of it goes back and forth. This happens on the outside because this happens on the inside, okay? Your neck folds, okay, the bands and the neck pleats, these are all because of the muscles that are coming down in the neck area, okay? So keep in mind, what you see on the outside is because there's something going on the inside. Now, speaking on the inside, we're going to move over to our next page. Let me go ahead and flip this really quick. And with this particular page, okay, we're going to go ahead and we're going to label a few things. We're not gonna, I know there's some spots that ask you to label certain things, but we're not gonna touch on every single one of the labels. We're just gonna go to some. So we're gonna start in this down here. Okay. This here is young skin. Oops. And this here is old skin. And I say that respectfully, okay? Young skin and old skin. Young skin is simply skin that does not have that many years under its belt. It's newer and hasn't seen that much sun, hasn't walked around and been exposed to that much gravity, hasn't had so many products and facial expressions and things of that on it, then the older skin or old skin has had those experiences and environments and things to face, okay? So just respectfully saying old skin, okay? So let's go ahead and label a few things before we get started. So here, this top layer, this is our epidermis. Okay, this top layer here. And the graph shows it just right in this section, but I'm gonna, so you don't get confused, this whole section here is my epidermis. So when I'm talking about epidermis on this side, I'm going to color this one as my epidermis, okay? It's the same graph. This is just young. This is how we all start. This is how we all end up, okay? All right, so that's your epidermis. And then you're gonna have down here from this section over, so it's the same on the other side. This is your dermis, okay? Here we have our hair follicle, which we've talked about. I'm going to outline it on the outside, and our hair follicle is the same on this opposite side. Okay, we do have our sebaceous gland, which I'm going to color in red, and I'm going to exaggerate the size so you can really see it. So that is our sebaceous gland. Okay, and so this is labeled up here, and it's the same. It's just not labeled here on this one, okay? So this one here is our sebaceous gland. Okay. Of course, we have here the hair, we have the muscle, the rectus pili, and then we have here our nutrients, our nerve, all of the sensory glands, all that's still in there, okay? But with this particular diagram, we're going to focus on something else that is within this part of the skin. So it has everything else in it, right? But we're going to now focus on two things, okay? Our elastic fiber and our collagen, okay? I apologize, I didn't label on this side. Let's label our hair. This is our hair, okay? All right, so let me get my marker here. Okay, so these, if you will, okay, these rope-like crisscross X's, and I'm gonna outline them on the outside so you can really see what I'm highlighting here. They go across like a crisscross, okay? They form the letter X all the way across. And when you have young skin, okay, it's like a rubber band. A brand new rubber band does very well as far as stretching, right? A brand new rubber band. When you get an old rubber band, okay, this is an old rubber band, and I had a little rubber band here, and where did it go? Oh no. Actually, I think I took it into the other room. I sure did. I apologize for that. But I did have another rubber band. And so our rubber bands are pretty, when you first get them, they're pretty tight, right? They're pretty, here's one. We'll use this one. So this is a brand new rubber band. Okay, this is an old rubber band. You can definitely tell by the color, and you can definitely tell by the texture of it. It's been definitely used, and this one not so much. Okay, I just had it in a little knot up here. But the new rubber band, when you pull it, it immediately wants to come back. It's resistant. Like even if I pull a little, it wants to pull my fingers back to its normal state. So if you will, the green crisscrosses that I highlighted here act as a rubber band. These are the elastic fibers that we each have in our skin. So when we pull on the skin, when we hurt ourselves, when we're stretched or moving around or whatnot, the elastic fibers will pull back together to their original position and state, and they will bring our skin and align it, the top and the bottom, it'll align it, okay, as it naturally and originally was. This will continue to happen until a certain point, which we'll go over in just a quick second. So with time, these little dots that you see that are floating around, these are now our elastic fibers. So we're going to label those. Elastic fiber. These are broken. Okay, they're broken. Here they're together, here they're broken. So here are elastic fibers, a brand new rubber band. And here, with our old aged skin or older skin, more mature, we don't tell your clients old skin. Don't dare tell them that. You tell them that they have aged skin or mature skin. Don't say old, okay? That's rude and unprofessional. And then, so this is the used rubber band, and so you see it, the shape is not the same as what it used to be, right? And it's kind of like when I pull, it pulls, but not as fast. It doesn't pull my fingers back as the other, and I can actually pull it a little bit further before it actually pulls together. So this is what happens to our elastic fiber over age. It's worn and torn and used and pulled and tugged in different directions. And especially if we don't have a good nutritional diet, we're not encouraging reproduction of cells and things of the sort to help maintain the elasticity of our skin. So then here you see these little grooves here. We start to get the wrinkles because the skin does not pull back. The elastic fibers don't keep this together anymore. They're not any longer attached. Okay, so that's the elastic fiber. Okay, the collagen. Let me go over the collagen before we move on. Let me do this one in pink. So the collagen, you'll see here, and it's going to get messy here. So the collagen is these fibers here, and it's also a crisscross, and these are kind of a little bit more long in the diagram here, but these are the crisscrosses, okay, and they're nice and thick and solid, and so these, okay, definitely allow our skin to have its I guess it's tightness. You're going to have the healthy looking skin, okay, as far as for its texture. Now, when you start to age, okay, you're going to see that here the collagen is not fully attached. You can see it's a little bit more hollow. You have some strong pieces, and then you have, some thin pieces. So you definitely begin to see, and let's go ahead and do collagen. That's this one here. And I didn't follow my little line here for the fiber. So we begin to lose the collagen. Now there are different things, the supplements you can take to help, like collagen supplements and things to help keep the strength of the skin, that you can help aid from the inside, like we spoke on the previous page. Okay, so this is important to understand. Over time, the sebaceous gland ceases to function like it used to. So some of the times, and I say some for a lot of the times, here you're going to see there's not that much production of sebation of the oil, the sebum. So then here you can see in this little zigzag here, you're going to have the skin loses moisture. Reduces. Well, this marker is not doing very good. Moisture reduces, okay? Sometimes it stops all the way. Sometimes it's a little bit. It just, again, it depends on each person. And then over time, with the collagen, the lack of the collagen that we have available to us now, and also the lack of the elastic fibers being in their original position, you see these deep V shapes here. okay? And I'm gonna raise this up a little bit. Let me bring my notes down, but this is going to be our deep wrinkles. Oops, did I get that? I got that on the other page. My apologies. Okay, so all of this happening underneath the skin, okay, can definitely be helped by what we consume, right? Our nutrition. But when it's important to know this, because when a client comes in, you can, whenever they're sitting at the reception desk and you're walking up to them saying, hello, my name is, I'm here to do your facial today, or to do your whichever service that you're doing for them today. As you're going up to them, you're able to to see from the outside, looking at their skin, their face, obviously, you're able to kind of tell the range of your client's age, right, by their skin. And the question would be, how is it that we age? How is it that our skin ages? So in your 20s, you have skin that looks like this. You hurt yourself, you paper cut, you fall and you have, like a wound, and, you have a little bit of a scab going on and it heals. Usually in your 20s, it takes about 2 weeks or so for your skin to heal, okay, from something that's not crazy major. When you're older, it takes twice that long, if not longer, because as we age, there's a reduction in stem cell. Okay, so what that means, or what happens, is that the skin becomes thinner. Okay, so just thinner and thinner. The stem cells reproduce. Okay, that's what they do. But over time, as the cell reproduction decreases, then the recovery time does take longer, which is why as you get older, probably like your mid to late 30s, you start to notice when you get a bump or a paper cut or something, you're like, ooh, that's taking a little bit more longer to heal. That's when you're starting to realize, okay, my skin is coming to a place where there's a reduction in the stem cell reproduction. Okay. So keep that in mind. The other reason why we also age is the fiber deterioration, which again, we talked about the collagen. Those fibers decrease in numbers. So there's not as many. So that has a huge contribution to our skin aging. The other thing are the elastic fibers. So when we lose the elasticity, our skin just doesn't bounce back like it used to when we were younger. Okay. The other thing besides this internally, like we were saying, things that happen on the outside are because of what's on the inside. So some of the things that happen naturally, obviously, unless if you're just a statue, but things that happen that affect what the outside of your skin looks like over time are facial expressions. So when you squint or when you smile, you're creating wrinkles, or you get angry, or you always have a pouty poo-poo face is what I call it. You look mad all the time, and you've got that wrinkle in between your eyebrows, and you're just walking around that way, even though you're not mad, right? You're not happy, right? It takes more muscles to be mad than more muscles than is to be happy, right? To smile. So when you're creating those creases in your face, bringing muscles together, you're folding your skin. And as you're folding your skin, over time, like the rubber band, over time the rubber band gets used, okay? So over time, you're going to see the change in the texture of the skin. Okay, so wrinkles and smiles, or I'm sorry, squinting and smiles create wrinkles, and they make the skin less resilient. So you just have to understand that concept. Now, I'm not saying walk around and don't smile. I'm just saying smile more than you frown, because the smile lines are nicer than the frown lines. Okay, the frown lines make you look older faster. Another thing is less immune cells. Okay, so there's a decrease in dendritic cells in the skin over time, and it decreases the immune response of how the skin helps aid itself in reproduction, or in in fixing itself. So like, let me go back to this page really quick. When we said the white blood cells come in and kill the bacteria, eat the bacteria up and eat the dead cells, and then take it back to its healthy state. That takes a part in that as well, in the aging of your skin, right? Because there's more going on in your skin. And your body has to work faster or harder to fix those problematic areas of your skin. Okay. The other thing that you can help is overexposure to the sun is something that also ages our skin. Harmful UV rays do damage the skin in general. Okay, they damage the DNA in the epidermal cells or the collagen fibers, which creates the skin to wrinkle and sag. Okay, so you've seen those celebrities and they wear those big old sunglasses that cover up to their eyebrows. It's not necessarily to look cute, although they do look very cute, but it's to cover their eye area from the sun really good so they don't wrinkle, because when they wrinkle a lot, then they get the wrinkles on their, when they squint because of the sun, it causes wrinkles. You'll also see that a lot of them won't drink out of a straw simply because you have to purse your lips, or they won't smoke because you have to purse your lips, and over time that creates wrinkles over the lip area. Okay, so those are just some reasons and some causes of why your skin ages. And then the title to this one, which I do apologize we did not do, aged skin. All right, so those are our two notes for today. We have our aged under the skin, and then aged skin just in general. Okay, so if you have any questions, please let me know. But other than that, keep in mind all of this information that we've gone over next week, because next week, when we're going to come back on Monday, we're going to start with our skin evaluation and our skincare record card for our consultation with our client. So we're going to work on this one, and then that as part of our theory. And then I cut this off, I apologize. But we're going to do this next one, which is a skin scope. So we're going to bring out the skin scanning machine, and we're going to, which is kind of like a black light, if you will, and you put your face inside of it, and it has a little curtain, and you're able to see these colors on your face, and then those colors indicate something, and we'll go over all of that. But that is what we're going to be doing to start our machine facials. Okay, so thank you for watching, and if you have any questions, please let me know.